Hi, this is Dr. William O'Neill. I'm the Executive Dean of Clinical Affairs at the Leonard Miller School of Medicine at University of Miami. Yes, Effient is available in our medical center, and I recently had a visit with the regional rep from Lilly that started to give me what they're going to be using as their canned sales pitch when they go out and try to market this drug to physicians. Well, it's obviously the sales pitch of this is wonderful, and they tried to denigrate clopidogrel and try to prove that the medication was more effective. And I had to sort of drag out the price. Right now, most pharmacies charge to people that actually have to pay for the pill $3 a pill for Plavix, which I think is outrageous. And now Lilly is going to compound the problem because they're going to charge $5.40 for patients that have to buy the new drug Effient. Well, they really are relying on the prasugrel versus clopidogrel in patients with acute coronary syndromes, or the Timmy Triton study. And in fact, their marketing brochure, I'm just showing it, is actually basically a copy of the New England Journal of Medicine article, and then inside this brochure, which they're going to be handing out to all the doctors. So basically, the overwhelming sales strategy is to identify the superiority of the Triton study, where, as you know, there was a mild improvement in net benefit for the patients in terms of a decrease in the major adverse events. I think if you carefully look at the study, the real question is what's the bang for the buck, because the majority of the benefit is seen in a decrease in peri-procedural MI that occurs on day one. After that, there's very marginal benefit. And I think that the trial design itself was somewhat suspect. Well, given the fact that it's going to be so much more expensive for the patients to take, I'm going to really have very little use for the drug. I really want to emphasize what a huge problem it is. Here in Miami, we have a large group of patients that are indigent, a very large group of patients that are working poor. And in those people, they have to actually pay for the drug out of pocket. And to double the price of this, to double the out-of-pocket expenses is just going to be a huge economic burden. And I really can't see that huge burden is going to be worth the very, very small decrease in risk in absolute sense of the numbers of subacute thrombosis that would occur in the chronic follow-up. I think you can accomplish equally what this study did by loading patients before the angioplasty procedure with clopidogrel at the right dose. I think you can accomplish the equal decrease in CK release that this drug accomplished by loading the patients ahead of time with 600 milligrams of clopidogrel. That's the current recommendation. Load it 90 minutes or more before the angioplasty procedure. You'll have adequate antiplatelet effect. I think that Effient does provide some better bioabsorption. I think it's absorbed very much quicker, and the reason that this study was positive was that they had more optimal antiplatelet relief at the time of the angioplasty. But with different loading strategies, I think you can probably accomplish the same thing. There is the risk that you're going to have an increase in bleeding in patients, and I don't honestly think that they can recommend who those patients are going to be. I think older patients, patients with previous TIA or stroke, small body weight are probably going to have too much of a concentration of the drug, and so you're going to have an increase in risk in bleeding for those patients. So I'm still scratching my head trying to figure out who, if any, patient would have a specific benefit from this drug over clopidogrel. So I think that this drug may have some advantage, and I'm quite interested in potentially figuring out which patients might have benefit versus clopidogrel. But the overwhelming issue is that we're told that there's a crisis in America with a huge increase in medical costs. We're told that the pharmaceutical industry is going to decrease costs by $80 billion over the next year, and so over the next 10 years. And so the timing for Lilly to double the price of this medication right at the current point in time when people have economic trouble, when the country's struggling with healthcare costs, I think is basically just the height of arrogance. It's just like the auto executives flying to Washington in their corporate jets. It doesn't make any sense. There's not that huge an incremental safety advantage over this drug. There's a huge increase in potential risk of bleeding in the wrong patients. And so for them to have this huge premium on this drug, I think is silly. I think that they could have gotten a very good market share, but I'm quite certain that many other physicians are going to be incensed by the fact that they doubled the price of this medication for patients that can hardly afford to take clopidogrel now.